It's April 10th, 2024. I'm in the United States of America with a Federal Reserve note, an ONE, and an In God We Trust, and Jackson at the White House. Up there's the flag. I'm in the iconic Queens section. I'm in the Queens section of, I guess it's New York City. It's New York State for sure. I don't know what those things actually mean. I'm in a 26-letter alphabet. On the schedule at education, it said English language arts. Yesterday was the 9th of April. I went to go see Dr. Holly Beanstalk, part of the Northwell health system. On April 2nd, I went to St. Francis. Both Dr. Trotta and Dr. Beanstalk suggested that I go straight there. I was having this weird blue haze, almost like a cataracts, but like really pronounced, impeding on my vision. So they said to go for a CT scan, which I did. I have the results here along with the blood work that St. Francis did. So I went to update the doctor from Northwell Health, since I have a doctor in each of the systems, not knowing which one's better and hoping that neither of them are trying to actually kill me, but to put me back into a correct health paradigm. So I went to see Dr. Trotta, and on her white doctor's jacket, and now, like, I don't know the difference between like a DO and an MD. I really not versed in that. But knowing that I went to NCC and I took some courses, and according to Star Trek and space exploration, what like the Roddenberrys put out there inside of the same country that I'm living in for reality, the captain of that starship Voyager said in a senior level management meeting that one person had enough credits. I know I have the matriculated credit, so whatever on the whatever, to speak on my own behalf. So the paperwork from the hospital shows that for some reason, out of nowhere, my cholesterol is high, which is not a consistent bodily physiology. It seems to come and go, which concerns me about area management and like whatever's going on. And TSH was high. The normal reference range is 0.5 to 4.7. I'm at 48. So instead of on the high side being 4, I'm at 48. So that's and again, and my troponin was high out of nowhere, which normally I don't have heart issues. So this is something very out of the norm, out of the ordinary, but very concerning, being 45 and having trouble walking now. I asked her about this, like Ozempic, Manjaro, and there was another one. And she had said that that they're all on back order because there's such a need for it on Long Island, that there's such a, like, they're coming into the doctor in droves asking for this medication because there's so many women who feel that they're overweight and they can't seem to lose it. I did go through the exact history with her. Dr. Beanstalk, however, came into the doctor's office with a gigantic pin with the Israeli flag on it, which I thought really interesting. Didn't say anything about it, didn't mention it. I don't get involved in their whatever they do. I was taken once by the astrological Cancer when she was getting married. She brought me to her bachelorette party in Plandome, and there was like a room of astrological Cancer's friends, and they were really nasty, like in the sense of like, I don't know, something about like, again, and that goes to like, how much did they know ahead of time that I didn't even know? They did something with her with toilet paper and wrapping her in toilet paper. Again, at that point, unfortunately, I was already married to Jay, who was a Taurus. And I don't know how that, like, I mean, I know it was a setup. Like, when I look back on it, I just don't know by whom. But it, then, like, now I'm hearing, like, Red Bull references. And it's just whatever, and the whatever. So, Lewis comes to me this morning. So anyway, so I went through this Holly Beanstalk updating, told her about this weirdness. She was taking copious notes. And then I mentioned her about, like, I'm in Queens. And she's like, no, I have a lot of patients from the area and from there. So, and I mentioned the milk. She really she really seemed disinterested to even take a note on. She's like, it's not the milk. Like, I felt like saying, but I didn't. Like, is that like your predetermined answer? Like, I mean, like, again, is that like pharmacology driven with her education on this or in this cycle? Stephen Colbert did a thing about like, your uncle's on fire last night. I thought that that was really interesting, but I was like, is that distasteful? Is that just part of the process? Having like a state with a UN in it and not knowing how like all the resources, like, I mean, they're putting in children from elsewhere in droves and seem to be reprioritizing like that they're more important than the children that are part of like the whatever and the whatever in other areas of the country as like one of the 48. So like, I really don't know how the conversation works in like actuality. But it seems like really important when like my troponins going up, my vision, my eyesight vision, like ocular, is having problems. Cholesterol's going up. I mean, there's lipids in the eyes that are being damaged and affected. And not quite knowing which one and what's throwing off. But I even said to her, I was like, well, just so you know, I was like, the milk in the house, like, milk's supposed to have like this creamy smell to it. I mean, I've been in other lactation, like I've sampled other lactation areas. It has this like creamy smell to it. The milk that's coming store-bought off the shelf coming into the house, when I heat it, it has the smell of burnt plastic. And I said, and my anatomy is in perfect condition. When they did the CT scan, there's no stenosis, there's no narrowing of the vessels, there's no any of that. I was like, but there's a physiological change, and I don't know what it is. And again, is she, like, technically, is she my clinician? I mean, is she the one who's supposed to be protecting my health? Like, is there a chain of command that she's supposed to be reporting these as, like, the interior ministers for medicine? Like, where's the chain of command? Who's reporting to whom? Like none of these things, there's no like clear chain of command from just being somebody trying to survive here. So, and like trapped in this process, but without a specific role. So that's incredibly frustrating. Then we leave and we're about to go home, and Teofrio decides he started this new thing called Instacart, which I want no part of. But he takes me on one of his routes just to show me what it is. He insists that I have to see what this is all about. So he shows me how it works. And as we're going to, and it turns out that the address is 5 Warning. I'm like, wow, in Plandome. I'm like, if that's not witchcraft, I don't know what is, but whatever. So we're going and we're stopped in traffic, and these 2 teenagers. Now, for anybody who knows Elm Street and Main Street by the fire department in Cold Spring Harbor, and how like the Keene Buildings grounds right before the harbor entrance is there, it looks very much like that, in the sense of like the setting, like cozy, quiet harbor town, because I'm in Port Washington at this point. And there's these 2 girls who just, like, our side, the way that our lane of traffic was going was dead stop. But the other side of oncoming traffic was an open lane. And these 2 girls walk in between. I have a Mini Cooper, which is what we were in, and a landscaping truck was in front of us. So it was high, they couldn't see the oncoming traffic. Now, like, my human and my mother instincts are, my instructions to them would have been, walk across in front of between the 2 vehicles, stop at the double yellow lines, look for oncoming traffic, and when you see that there's nothing coming at you, cross the street. But that's not what these 2 did. These 2 teenage kids. They walked in front of my stopped vehicle and just ran as fast as they could, didn't even look for oncoming traffic, and the girl gets hit by some unassuming mother with 2 kids in the back. I immediately was just like, I could see how shaken this woman was. It was not her fault at all. I mean, these kids didn't even look to oncoming traffic. They just ran. So she flips, the woman hits her so hard that she goes up on the hood and then thrown to the floor. So now Teofrio pulls over, and it's like, I don't even want to spend 5 minutes with this person that I'm in the car with. But now these kids like got seriously hurt. So, I mean, she stands back up. There's no broken bones. But now we're a witness to this accident that happened. So we do the responsible thing. He pulls over. I'm like, oh, so we get out of the car. Like, I really don't want to get involved, but I'm there. And now I see this happening. So we wait for the police to come over. The driver that hit the kids is shaken. She's got to tend to her own kids. So, and then the kids that got hurt are sitting on a bench, and I'm, like, again, outside of my eye, I can see she's conscious. She's talking. She's on the phone. She's all right. There's no broken bones. Like, you just assess the situation. She's not critical. And then I see someone, reminds me very much of Cold Spring Harbor, who walks up, but he looked like he came out of the deli, and he's like walking down the street. But then when he walked past me, and I could see he's looking, but he's not quite sure because it didn't look like an accident, but he must have heard it. And I said to him, and I saw in the back that he was with the fire department, Fort Washington Fire Department. I was like, "Are you here because you heard it on the scanner?" And he's like, "Yeah." So I explained to him what happened, and then the cops show up. So in the scratch book, not like the official one, but like the whatever the, I mean, and again, these are village police, so it's county, it's included in Nassau County. I mean, I was in Nassau, but Port Washington area. So the name and numbers down on that scratch pad that I was there and one of the witnesses to this, whatever happened. So then, like, they came, they had it covered. We asked if it was all right for us to leave. Did they need anything more from us? Can we leave? They said we could leave. We left. Get back in the car, finish the Instacart thing that he was already in the process of, that I didn't want to take part in, but here we are. And then, and this is like, again, part of like the blacksmith part of like the second Red Bull. It's just like, so we finish that up and then we come home. So long story short is I asked and I explained to Beanstalk when I was at the appointment, I'm like, I was running before I broke my ankle. I was like, I was running 2 hours a day, consistently disciplined, 5 to 6 days a week for 7 months. Reduced caloric intake, and there was no significant weight decline whatsoever. I was having trouble with my legs, with like movement, and with them seizing and locking up. It's the same thing that I have going on now. So now I have also like some joint pain and whatever. But like I was telling my dad yesterday, we went out for a walk in the morning. I'm like, I start off, I feel like really like, I'm like, it's almost like having fluid in a radiator or oil in an engine, and like you are able to move, and like the engine, the pistons are going, everything is just great, and then all of a sudden something happens and alters it burns off, and then it starts like friction starts. And that's how my muscles feel right now, is that it's at this deterred like intracellular exchange where my muscles are seizing and locking up, and I, again, like, I don't know what they've introduced through the food and the process of like changing the chemical receptors where the body's just not working right. I don't know what the remedy is. It's some kind of poisoning. I mean, technically it's some kind of poisoning to then sell you some remedy to correct it. And somebody's making like money off of it. I don't know who. But I'm stuck in this process. Like, I just want to live like my body was supposed to be intended for. I don't want to blow up with all this excess weight. I don't want to have thyroid problems, cholesterol, all this other stuff. To what? To pay for somebody else's country's kids to come be next to me? Like, I'd rather go live out in Mormon territory amongst like people that look like myself. Like, that's my dream. But I'm stuck in New York in the complete opposite phase of like human existence, and it feels like I'm being subjugated to punishment on top of it. And for what purpose? Like, it makes no sense to me. So that's what's going on in the local area. So I just keep making, like, just collecting evidence and making medical notes on my own behalf as to what's going on, because there's a whole lot of stuff that's in the works, and it looks like it's going in the wrong direction when I look up the TV. Um, and I look at how my life like is evolving. I mean, it went from like bad to worse. And like, where's the light at the end of the tunnel? Where's my exit ramp? Like, where's my off ramp to get to something better? I mean, my quality of life is being impacted, and there's no like quantity of life at this point. I mean, it's 4 decades of everything's just gotten worse. Um, it's star 1978, star 8378, Nicole, Cattaruzza. It's Earth, solar system, Milky Way, universe, galaxies broken. And then I just went for a walk this morning. And as I'm walking by the camera where there's this at times, just to let them know that I'm walking in case anything happens, just that I'm in the local area. There was one police officer at the corner where I cross, and then another one sitting across the street on the opposite intersection, for whatever that means. But that was the only like unusual thing from this morning. But again, that's County Queens line, and yesterday there was Port Washington Nassau line. And that was me going to the St. Francis Heart Center hospital, and also the crossover to Northwell Health with whatever's going on. Like, I mean, I haven't been asked, like, devoted to whatever, but haven't been able to make votes or elections for some reason, has been silenced, like almost like some kind of mutinies perhaps happened. I really don't know the words or the verse to use, but I've been muted and I don't know why. So now I'm using this platform to at least hand raise and say, this is what's going on. This is not right. I don't know who's in charge. I don't know how this is all unfolding this way. I don't even know how to safely participate to get my voice heard, but here we are. Again, today is April 10th, those were the events from April 9th, 2024.